More on healthcare reform and job creation on HealthSource, and I'm Dr. Scott Fuller. If you want to talk about the program that I suggested about healthcare reform and job creation in this country, in the United States now, it was a January of 2010 program. Refer back to my other show, contact the Woburn Public Media Center in Woburn, Massachusetts to obtain a copy. We actually hope to get this on YouTube as well. Call my office. But this is a follow-up show. Now we're in towards the end of January of 2010, and now you're getting all of that new information about healthcare reform. Now that we have a new senator from Massachusetts and not a Democrat, very big surprise to everyone in the nation, that could change things. But regardless of the politics, I want to talk about you, your health, and your family's health, and how to save the entire country hundreds of billions of dollars. On this show, I'm going to focus on vitamin D, fish oil, exercise, and some basic nutrition principles that go along with my program that I've already laid out about setting up clinics across the country to teach people healthy eating habits, on how to show people how to shop healthy, cook healthy and quickly, and how to get exercise daily on a regular basis, and all these clinics would have exercise programs and so on. So that was my prior show. So I'm going to talk about these things. Now, let me get into some statistics that I was just looking at this morning to put all of this in perspective. It is estimated we spend $2.5 trillion per year right now in this country on medical care, health care. $2.5 trillion. Some statistics. If you look at the World Health Organization, and they looked at the rankings of the world's health systems. And the last time they did this was in year 2000, so this is 10 years ago. Because of the monumentous undertaking that this requires, they're not going to do this anymore. But let's go by the 2000 figures. The United States, was the United States number 1 in the world? No. Number 2. Top 10? Top 20? No. They ranked the United States at number 37. That was the ranking of the world's health systems. U.S. is number 37. Who spends the most money per person and the largest percentage, with a rare exception, I'll get into that in a second, compared to anybody else in the world? The United States is number 1. So we spend more money per person than any other nation, but our ranking in the world's health systems is number 37. Well, who's number 1? France. I'm going to zip through number 1 through 21, and you're going to see some similarities in these countries. France, Italy, San Marino, Andorra, Malta, Singapore, Spain, Oman, Austria, Japan are the top 10. Norway, Portugal, Monaco, Greece, Iceland, Luxembourg, Netherlands, UK, Ireland, and Switzerland, top 20. And I just wanted to throw in number 21 was Belgium. So you can see that a lot of these countries are European, Mediterranean, some Asian countries as well. Interesting. Now, some other statistics. Again, from the World Health Organization. Healthy life expectancy, is the United States number 1? No, we are number 24. Even though we spend more money per person than any other nation in the world, and a highest percentage of GDP, gross domestic product. Health performance rank. You listen to this now. Our health performance rank, comparing our country to every other country in the world, number 72. 72. I mean, we're talking 71 countries outperform us, even though we spend more money than anybody else. As I said before, health expenditure per person or per capita, we are number 1, by far, bar none. What we need to start doing is getting into shaving costs. Now, technically, according to this chart, and we'll get into this, this was interesting. Total health expenditures as percentage of GDP, gross domestic product. Between years 2002 and 2005, we were technically number 2. Who was number 1? The Marshall Islands. And I thought, why is the Marshall Islands number one? And it was listed back in the 50s, 60s, 70s as the most contaminated place on the planet. Does anybody remember why? The nuclear tests we used to do. Remember the bombs that we used to test that was all around the Marshall Islands. So they're number one. They've been self-governing since 1979, so they're considered a separate entity, a separate country, but you can imagine the U.S. influence. So I kind of don't count that because of being the number one contaminated place in the world because of our nuclear bomb testing there in the past. So they're at like 22% GDP. United States is around 15%. Those are the statistics there. They might be newer stats that are out there. As I get into vitamin D to save you money and to save us money, fish oil to save you money and save us money, exercise programs and basic nutrition programs to save us money, I'm going to very quickly review my prior clinic show so you can understand what my proposal is to change healthcare in this country and save us hundreds of billions of dollars. So this was my health reform and job creation deal. I wanted to focus more on prevention. We focused more on prevention with better nutrition and a whole lot of exercise. Also, no more smoking. I talked about that on my prior show. We need to make sure that the tobacco lawsuit money stays with the smoking cessation programs, particularly in junior high and high school, to make sure that those smoking rates drop, they don't rise. Number two, we wanted to talk about focusing on saving money. We save money by prevention. We save money with better nutrition habits and regular exercise. We know that 2/3 of all cancer in this country is caused by three things: whether you smoke or not, whether you eat good things or not, and whether you exercise or not. It sounds to me that we should funnel most of our focus, most of our media attention, and most of our money on those types of programs, just like we do with the smoking cessation programs, right? Number three, I talked about how we would fund clinics across the country to help people with basic nutrition habits and exercise classes all the time. The funding would come from, right now, any additional federal stimulus dollars that would come into the states from the federal government. After that, the savings to the healthcare $2.5 trillion would easily fund these clinics moving ahead permanently. So we would need some initial startup money. We don't need any additional infrastructure because we're going to use schools and clinics and existing civic organizations and buildings. So the funding would come from federal stimulus dollars. We're going to create jobs. We're going to create jobs of all sorts. We're going to create jobs from nutritionists, cooks, social workers, gardeners, farmers, local farm jobs, exercise physiologists and personal trainers, aerobics instructors, janitorial and security, because we would need after-school janitorial and security details for these buildings that we were going to be putting adults and families in. That's the job creation part of this, okay? And then I talked about chiropractic. I talked about one of the most common phone calls that comes into a primary care physician's office, a chiropractor's office, a physical therapist's office, are for spinal pain syndromes, never mind the other things that chiropractic is successful for. But chiropractic has shown to be more cost-effective, more long-term relief for these people. It completely dusts anti-inflammatory drugs with very little to no side effects, and anti-inflammatory drugs have big, nasty side effects which costs us a whole lot of money. So I went through those studies in a prior show. That's why I included that. So those are these clinics that I want to set up in every town and city around the country to show people good nutrition habits, how to shop, how to cook fast and nutritious, and then having exercise programs of all sorts for all kinds of people, regardless of their physical condition at that time. And there can be some classes that are even based with chair exercise programs. We're going to talk more about exercise. Even with my mother, I bought her chair yoga DVDs for home because she can't do a lot of the things standing and on the floor, so now she can actually do a lot of exercises in the chair. There's always options and opportunities.